Hi all, a very good morning to everyone. This is Nizam from TechM. I'm very excited to demonstrate our new Safe Hands patient engagement platform, which is built on Pega Infinity and powered by Pega AI. So we have been using AI for different kinds of use cases of Pega, like the real-time decisioning, the marketing, sales automation, etc. So this is a typical use case which utilizes AI for good. Let's go into the use case. The use case mainly deals with current world problem of healthcare systems across the world. Patients are getting occupied and they are not even getting time to cancel the scheduled appointments. According to a recent study, 1 out of 5 patients who schedule an appointment don't show up. In the last 4 months, due to the current pandemic situation, it has stressed the healthcare infrastructure of most of the countries. So we decided to build a single platform for doctors, patients, and healthcare staff to improve the healthcare utilization using Pega AI. These are the real-world impacts of no-show appointments based on a survey. There are around 62 average missed appointments in a community hospital in US, which leads to 3 million loss, and it altogether leads to 150 billion loss to US healthcare per year. It also lowers the healthcare utilization of doctors. Major reason for no-show appointments is that 38% of the patients do not know that there is an already booked appointment. Solution not only reduces no-show appointments but also brings patient engagement with contactless collaboration and personalized healthcare or medication reminders. This solution has a wide scope not only across primary cares but can also be used for clinical trials and virtual healthcare appointments. Let's start the actual demo of our Safe Hands application. It has 3 actors: healthcare staff, patient, and a doctor. So this is the microjourney workflow. To save some time, I have recorded both the videos and I have placed side by side. So on the left hand side, we have a healthcare assistant like the healthcare staff who logs into the desktop portal built on Pega, and he creates a new patient registration. All our portals, whether it is a doctor portal, patient portal, or health staff portal, are self-tooled. He can also view the dashboard reports of all the appointments, missed appointments, and scheduled appointments, and all the registrations as well. And coming to the right hand side is the process of patient, where he logs into the application. We are sending a user ID with a temporary password with well-written instructions for both desktop and mobile apps. We support Android and iOS apps as well. Patient can view all the appointments which are scheduled, which are cancelled, and which are even completed. Patient can view the prescriptions and his My Prescriptions. He can view all the notifications which are coming as push notifications to his device, and in fact, lot many engagement options. And patient can view the healthcare documents and healthcare tip videos, diet videos, etc. using the My Documents out-of-the-box gadget. He can also post any health-related queries using the out-of-the-box Pulse gadget from his mobile or desktop. Let's see some of the main features of our application, which includes predicting no-shows using AI, contactless virtual appointments integrated with Skype, automated prescription reminder framework built on top of out-of-the-box Pega notification framework, patient-centric mobile app built using low-code mobile app builder, instant collaboration platform between patients and healthcare users, and the last one is the patient data steering, which includes medical data, health tips, diet videos, and general exercises, etc. Let's see the demo of appointment booking microjourney from desktop and mobile app. In order to save some time, I have recorded both the videos and placed side by side. Let's book an appointment by clicking Schedule Appointment. We need to select date, visit type, and slot based on the availability. We support both in-person and virtual appointments. When it is a virtual appointment, we are asking to enter the Skype ID of the patient. Once the data is entered and submitted, an appointment is booked and confirmation is shown. And coming to the right side, we have used a Pega mobile app built using the low-code mobile app builder, and the app supports both appointment booking, cancelling, and rescheduling as well. In this scenario, I have cancelled an appointment with a valid reason, and we can even use the floating action button to create new appointment. We also integrated this app to open other apps like Uber and other transportation apps in emergency situations when there is no transport available. Let's see the demo of contactless collaboration between patient, healthcare staff, and doctors. I logged in as a patient into a desktop application. Let's go to post a query. So I'm posting a question here, and a question has been posted. Healthcare assistant portal. In this portal, let's go to answer queries. And I have an appointment. Let's answer this question by a healthcare assistant. So let's go back. I'm back to my patient portal and I got one notification. Let's see what is this notification. Healthcare assistant has added a comment. Let's see what he has added. Healthcare assistant says, yes, I can reschedule the appointment. Thank you. Let me log in as a general doctor and view all my consultation requests in my doctor portal. I can view both virtual and in-person appointments from my portal. Let me open one of the virtual consultations. We have integrated Skype to support virtual appointments. Once we click this link, it directly opens Skype and calls the patient to his Skype ID. Let me call this. Let me do this. Let me select symptoms from the symptoms list. And how often is this? Severity. Since let me select the prescription, the frequency of the prescription, special instructions. Appointment is not needed. Just click submit. A consultation has been successfully resolved. A medication list has been sent to the patient. Let's go back to the patient portal. And we are also sending prescription reminders to the patient before meals, during lunchtime and the dinner time, using our own, by building a prescription reminder framework on top of Pega's out-of-the-box notification. We have also built a multi-channel web bot which helps the patient to know the appointment details. Let's go here and click chat. Let's say hi. So I need to know my appointment details. It is asking to enter the appointment number. My appointment has been confirmed on 6/24, 5 p.m. Thank you. Finally, let's talk about our AI model, which is used to predict no-show appointments. So this is the supervised classification models with two outcomes, binaries, show and no-show. We got a Kaggle dataset with 110 records, and we have classified the predictors as appointment predictors and patient predictors. Let's go to the predictors tab. So these are the predictors which we are using for predicting the appointment no-show. The scheduled day of the appointment, month of the appointment, gap between the appointment scheduled and the actual appointment, distance type, time taken, age, visit type, etc. And these are the positive outcomes and these are the negative outcomes. When a case is successfully completed, we are treating it as a showcase, the positive scenario. But when it is rejected or cancelled by the doctor or the patient, or whether it is a no-show by the patient, so then we are treating as a negative outcome. Finally, I would like to thank Pega for giving this wonderful opportunity to participate in this hackathon. And also I would like to thank my wonderful team who is behind this journey. Thank you so much.